Good morning, everybody. My name is Kata, and welcome to Kata B Fitness. And today, I'm just going to show you some of the therapy exercises that I have been doing for my knee. The doctor is thinking that I just have a little bit of meniscus damage. It's not like a crazy, full-blown tear. I don't need surgery. For me personally, I think it's been about 3 weeks, and I'm already feeling, at about 95%. Everybody is a little bit different. Some people have really bad tears and they're going to need therapy. They're going to need surgery and then therapy. But I've been very lucky in that it was just a little bit of damage. The swelling went down after a few days. This is also good for somebody who has had a medial collateral ligament sprain. So thinking about a sprain versus a tear, but always go based on your physician's guidelines and especially your physical therapy. One of the things I always tell people is if you are given physical therapy, do your physical therapy. That is going to help you so much. And a lot of times it won't feel like it is, but trying to rehab from an injury or from surgery, it takes time because we did something very traumatic to our bodies and it takes time for us to recover. And unfortunately, as we age, it takes longer to recover from injuries and things like that. But doing your therapy, staying as active as you can, is a great way to be able to enhance your recovery period. My physician, told me don't be afraid to take anti-inflammatories. I usually only take them if I absolutely need them. But he said for the swelling and things like that, don't be afraid to take them if you need them. And even if you just have that little bit of swelling to help reduce some of that pain and discomfort. But always remembering to take it with food. You don't want to take something like ibuprofen on an empty stomach. But I'm just going to show you the therapy exercises that I have. I start with just one set of 10, and then I actually start with the first 5 exercises, and when those become comfortable, then I was able to add in the other exercises. The first one that you want to do, and this is one that you do if you cannot completely straighten your knee. So if you straighten your knee and it's still kind of tight and it's still elevated and lifted off of the ground, you can just take a towel, roll up the towel. I'm just going to demonstrate with the yoga block, but what you're going to do is you're going to place that yoga block or the rest of your ankle on top of a rolled up towel, and you're just going to focus on trying to allow that knee to straighten. And you're just going to let gravity pull down on that knee. And this is one that's going to be, it's very likely going to be kind of uncomfortable when you first start doing this one. So just kind of keep that in mind, and you just want to let it rest and relax. Thankfully, I am able to get my knee completely straight, so I usually don't have to do this particular exercise. But I just wanted to demonstrate for people that maybe aren't able to completely straighten their knee that this is an exercise that you can start with. So you're just going to try to hold it, 10 seconds or so, and gradually increase how straight your knee gets and increase how long you can hold that particular exercise. All right, so after you're able to do that, your second exercise, this one, if I had a slider, I would use it because this is not a slick floor, but we're just going to take the leg out straight, and then we're just going to slide it in, bending the knee, and then we're going to take it back out again. Now you can have your other leg straight. You're just going to slide it in, and then you're going to slide it out. And again, this is a good one to do on if you have vinyl plank, or if you've got wood flooring. On this one, I probably should be using a glider because my foot keeps wanting to stick to the floor. But you're going to do a set of 10. Start with a set of 10, work your way up to 3 sets of 10. And as we do this one, we want to make sure that we're not, when we're bringing it in, we're not letting that knee wobble all over the place, or we're not bringing it in and letting it slide out or slide in. We want to try to just bend and straighten the knee the best we can, going out, in and out. Good. And then we're going to lean back, and you can be all the way on your back for this one if you want to. So we're going to have our other knee bent. We're going to squeeze our quad, straighten our knee. I like to flex my foot, and we're just going to lift a few inches off the ground, and then we're going to set it down. So we're going to lift, and we're going to set it down. So we're stabilizing our knee by squeezing our quad, and then we are just using our hip flexors and our quads to lift. And again, we're going to do a set of 10. Eventually you want to work your way up to 3 sets of 10. Good, so I'm going to do about 4, 3, 2, and 1. Good, and now we're going to flip over onto our tummies. So all the way down onto your tummy. You can rest your chin on your hands. We're going to take that injured knee. We're going to do a little flex of your ankle, and we're just going to bend the knee, little squeeze and hold it, and then take it down. Good, and again, squeeze. So bring it up and down. So we're starting to work those hamstrings. So we just straighten the leg, and then we bend our knee, and we kind of do a little squeeze, almost like you're trying to pop a balloon behind your knee. And this is a good one if it's a recent injury. Start slowly. We don't want to fly through these. So part of this is just training our body to know that it is okay to move. We just have to find that range of motion where we're not feeling, excruciating pain. But we're starting to strengthen the muscles that surround the knee, and that's what's going to help protect it. Good, we're going to do one more right here, and then down. All right, and now we're going to roll onto our sides. And you can bend your bottom knee as needed, but again, same thing. I want you to squeeze your quad to help keep that knee nice and straight. Flex the foot. Don't let the foot come forward. Don't let it go way backwards, just straight, and we're just going to lift. And then we're going to set it down. So now we're working the outer thigh and hip, a little bit of side glute. And again, working your way up to 3 sets of 10. And a lot of this is just kind of mind over muscle. We don't want to just start flinging our leg up and down. Good, 2 more. Here's 2. And 1. All right, we're going to bring it in. We're going to come up to a standing position. For these next exercises, you're going to need a resistance band, and you're going to need to be able to secure it to something. If you have a door that you can tie a knot in the end of your band, put it through the door, and then you're going to pull the door closed. You don't want to put it in and push the door closed, so it depends what side of the door you're on, because while you're pulling on that band, you don't want the door to pull open. You can also, if you've got like balusters on your stair, you can tie it around the baluster of the stair, and then the other end is going to go around your ankle. I have it tied to this. This is not my ideal way of securing this, but the way that my doors work, I'm not able to do some of this. So the entire goal for working these muscles is we're strengthening the muscles, but we're also trying to stabilize the knee. So we're stiffening that knee. So I'm just going to have my weight on my standing leg that does not have a band. I'm going to bend my knee a little bit, but I'm going to focus on keeping all these muscles tight. And I'm going to start with just a back and a forwards, back and forwards. And again, we're going to do, of course, that's going to happen. Make sure it's nice and secure. We're going to do 10. I was trying not to tighten this too much, but it didn't work. Good, so I'm going to start with my 10. But again, we're not bending and straightening the knee. We're stiffening the knee so that your knee is nice and stable. And that's something that you really have to think about. And I know for me personally, when we start doing the inner thigh work, I'm really going to have to focus on stiffening up my knee and working the inner thigh while stabilizing my knee. Good, and there's 2 and 1. All right, and then we're going to carefully turn. So we're going to hit all 4 directions. So now it's the same thing, stiffen the knee, and we're just going to take it out and then bring it in, out, and bring it in. As you can see, you got to hold your balance. So if you need to, you can hold on to something. Good, 5. So we don't want to just kind of let the knee do whatever. We got to lift, stiffen the knee. 8. Here we go, 9 and 10. Good, now we're going to carefully turn And then we're going to do the same thing. So leg is a little bit back, stiffen your knee, and you're going to take it forward and then back, forward and back. Good. 5, 4, 3, 2, and 1. And then, sorry for the backside view. I'm trying to remember if I've got to bring it across. Yeah, if you can, bring it across. Otherwise, we're standing nice and stable. Again, stiffen the knee. I'm going to pull it across. 10, 2, 6. Good. Now we've got 4, 3, 2, and 1. Good. So shake it out. And you're getting just as much work, at least I am, on that standing leg because that's the one that's holding you up. So your next exercise is you're going to need a wall. And you're just going to take your feet about a foot or so away from the wall. Feet are going to be hip width apart, and your goal is to keep your shoulders and your back against the wall, and you want to take it down and try to get to a 90-90. And as you do this, you want your knees to be directly over your ankles. You're going to take it down. You're going to hold it for a count of 10. So you're going to hold it as long as you can. Maybe you can only hold it for 5. That's okay, but work your way up to 10 to start with. And then again, we're going to squeeze our quads, push to bring ourselves back up to standing. And then same thing, you're going to do 3 sets of 10. Now your challenge as well, once you can do your 3 sets of 10, is you want to start increasing the amount of time that you can hold this wall squat. So start with a count of 10 and then start working your way up so you can hold it for 15 and 20 and 25 and 30 and go a little bit longer. And again, squeeze your quads, press through to come back up to standing. Good, and we're going to do one more. So we're just going to drop it down. And again, head, shoulders, low back against the floor, against the wall. Knees are going to be over your ankles. So just a nice good squeeze right here. Nice good tense muscles. Good, and then you're going to take these knees, press through to come yourself back, to bring yourself back up to standing. Carefully walk yourself back. Next exercise is we're going to do kind of a side step up. Again, this is knee strengthening and stability. You can use a yoga block. You can use a block of wood that's 3 to 5 inches high, or you can use just a step platform if you have one. So we're going to place that injured leg on your yoga block, your step, and all we're going to do is we're going to press up, and then we're going to go down. We're going to press up, and then we're going to go down. So it's just kind of a little side step up and then back. And we want to control it. We don't want to just drop the foot to the floor. But again, we're getting that knee used to doing our bending and straightening. Good. We're going to do 4, 3. I can tell I'm getting a little bit tired. I've already done a couple classes today. 2. Good, and 1. And we're going to go ahead and bring it down. I have one more exercise that I'm going to add in. I had to reread it to make sure that I knew that I was doing it correctly. I was struggling a little bit with that one. So we're going to go back to our band, and this time we're actually going to try to put it around our knee. So the leg is going to have that band on it. And we're going to take it up and around our knee. And we're going to tie it off. And so what we're going to do is we're going to have it behind our knee, make sure it's nice and secure. We're going to lift our other leg off of the ground, and we're going to bend the knee, and then we're going to straighten the knee. So we're going to bend the knee, and we're going to straighten the knee. So we bend and we straighten. We bend and we straighten. So as we straighten, we're having to use those quad muscles and our hamstring muscles, bend and straighten. So it's the straighten portion that is actually challenging us a little bit more. It's also single leg stand, so if you need to, hold on to something, but it's just a little bend, and then we straighten, and then we bend, and we straighten. Good, let's do a couple more. Bend and straighten, and bend and straighten.